Hi, I'm Dr. Robert Erickson, gastroenterology, Essentia Health. My decision to join medicine and as a career was preceded by experience as I had in high school and in college with mentally disadvantaged adults in healthcare settings, and it was at that time that I knew that I really wanted to work with people. Remember, patients aren't diagnoses, patients are patients, and so you get to take the patient's past history and everything that's involved in their social situation together to synthesize it for that particular patient to come up with a diagnosis and to help that person. This is after an endoscopy. I sat down with him and he told me about he was involved in the invasion in Normandy, and then we got into talking about the Civil War, and he actually met a Civil War veteran. I think that's going to be the only person I'll ever meet to meet a Civil War veteran. I'm a little bit of a Civil War buff, so you can really get into more than just what you're doing at that particular time, which is what I really enjoy. To be real collaborative is that I want to walk side by side with them in this particular process, where we go through a diagnostic process. And the last thing I always like to leave with the patient is that we're always there. I mean, someone in the organization is always there. I mean, at night, there's someone there, a nurse online. There's always someone in our office that's on the phone, and my health is wonderful. I think patients have really warmed up to my health. Families first, once a parent's always a parent, and secondly, I like to be active, so I've taken running small or short races, and even yoga. I've discovered that's been very interesting. And for relaxation, I like to read, and I've been reading anything and everything I can about Lincoln, and I think he brings a lot of values and just a lot of insight that may help us personally, and certainly as a society, as we struggle with our everyday society problems, and even struggles in medicine as we change in medicine.